This is the overview of pain assessment during your OSCE. Now we are going to go on to perform this station. In today's video, I am going to enlighten you about how to do the pain assessment on your OSCE day. Pain assessment is one of the stations you are going to get as a nurse associate, and as a nurse, you are going to likely get this station as part of your OSCE presentation. It is a clinical skill, just like we've been talking about in our previous videos. You are going to get pain assessment as part of your clinical skills. Pain assessment is a performing station. When we say a performing station, you are going to approach your patient and talk to your patient. But when it comes to silent station, you are not going to say anything to the patient. You are literally just going to sit there and be timed, and you will do whatever you are supposed to do on that station. In this station, you are going to be given a scenario with the patient details. So you go and approach your patient, and you are going to talk to your patient about the pain they are experiencing. Your patient is experiencing pain, and you are going to conduct a pain assessment on this patient. What does this station entail? So in this station, you are going to first approach your patient, introduce yourself, gain consent, and then you proceed with a questionnaire. You are going to ask the patient a series of questions about the pain they are experiencing and how best you can help them. You are going to approach your patient and go through a questionnaire with them. In performing this station, you approach your patient and assess for scene safety, provide privacy and dignity, perform your hand hygiene, and then you introduce yourself to your patient, gain consent. I'm here to conduct a pain assessment on you using the PQ tool. You're going to use this tool to assess the level of pain of your patient and every details that comes with the pain assessment. You are going to go through the questionnaire, the PQRST. The P stands for provoke, Q is for quality, R is for radiating, S is for severity, T is time. So you are going to go through this questionnaire with your patient to be able to plan a better care for them. Now, what goes into provoke? In provoke, you are going to ask the patient where the pain is, because from the beginning, you have just been told you are going to ask the patient some questions about their pain, but you need to know where the pain is. What causes the pain? What makes the pain better or worse? These are the 4 questions that is in the marking criteria that you are going to ask your patient. What causes the pain? Where is the pain? What makes it worse or better? And then you go to the quality. In quality, you are going to ask about how the pain feels. What does the pain feel like? Is the pain dull, sharp, stabbing, burning, crushing, shooting, throbbing, or is the pain intense? These are questions you are going to ask your patient for them to describe exactly how the pain feels. The next thing is radiating. In radiating, you are going to talk of where is the pain. Is the pain at one place? Does it move around? Or does it start from somewhere? The name radiating depicts that some of the pain the patient will be experiencing can radiate from a certain part of the body to the other part of the body. From part A to part B, you would want to know if the patient's pain is radiating or not. The next thing we are going to talk about is severity. In severity, you are going to use the universal pain scale to assess the state of the patient's pain on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain. How would you rate your pain? We all know that from 1 to 3 is mild, from 4 to 6 is moderate, and then from 7 to 10 is severe. The patient would then score whatever the rating scale is so that we can know the intensity of the pain or how the pain is actually feeling like. This will enable the doctor plan the appropriate medication for the pain. When it comes to pain management, you have to identify all these things to be able to prescribe the actual medication for your patient. In mild pain, they can have like paracetamol, but when the patient is experiencing a severe form of pain, you cannot give the NSAID, which is the paracetamol. This will help the doctor plan a better pain management for them. The next thing on the marking criteria is the time. The T is for time. In time, what are we going to talk about? When did the pain start? How long has it lasted? Is it constant? Does it come and go? Or is it sudden or gradual? These are questions you are going to ask your patient about in time. You can go sequentially and ask the PQRST. Another thing you need to know is if at any point you forget that you have not asked a question about radiating, but you have asked about provoke, quality, and then you moved on to severity, you can definitely go back and ask these questions. You are not supposed to be pressured at any point in time if you feel like you've not asked the questions in the PQRST sequence. So at any point in time, if you are asking the questions and anything pops in mind, you can go ahead and ask. Other than that, you can also plan and practice so that you'll be able to present it sequentially. However, if you can't, that is also all right. The next thing is to inform your patient if they are happy for you to refer them to the pain management team. Are you happy I refer you to the pain management team? Don't forget this. This is one of the key things you are supposed to do so that they can plan a better care for the patient. Another thing is you offer the non-medical interventions to the patient. When we talk of non-medical interventions, these are repositioning your patient, encouraging them to engage in deep breathing exercise, inform them that there is a need for them to hydrate. These are the non-medical interventions that you encourage your patient to also do to help them with the pain management. We are going to also highlight here in general, when it comes to pain management, you're also going to talk about the fact that if the patient's pain is severe and they've taken pain medication, then it means that the pain medication, you're going to ask them, when did you take that? Or if you check their prescription and you notice that they took the analgesic 2 hours ago. If it's 2 hours ago and it's not working, then it means that that is not the appropriate medication for them. If you check the marking criteria, it says that ask whether they have had analgesic so far and state that you would arrange for suitable analgesic. It is on the marking criteria to offer the patient this advice. So if at any point they've taken a pain medication 2 hours ago and it's not working, then it means that you have to escalate it to the medical team and then they will give the appropriate pain medication for them, because as I said before, in mild pain, you can manage with medications like paracetamol, but if the patient is experiencing any form of severe pain, you are not going to be able to manage them with the paracetamol. So they will take an advanced pain analgesic, which can either be codeine, morphine, etc. These are the things you are going to talk about. And you are also going to identify the need for regular reassessment of the pain. You will talk about the fact that the patient's pain has been identified now, but whatever intervention that you put in place, you are going to come back to do a regular reassessment of that pain so that they will be able to manage it appropriately. If you come back, you've assessed me now, and then my pain level is 8, and then you plan a better care for me, you notice that when you came back 3-4 hours later, my pain level is still 8, then it means that the intervention that you've put in place is not working. So you have to plan the appropriate intervention to suit my management. You have to make sure that you are going to do a regular reassessment of the patient's pain. Obviously, you are going to act professionally, and then you indicate the need to document all your findings as required. So in pain management, there is no attached documentation to the station. You are not going to document anything on any paper, but you verbalize it to the patient that you are going to do documentation. As part of your nursing practice, you know you would have to write a nurse's note after this station. That is the overview of pain assessment. The first thing, you are conducting an introduction, gaining consent, and then you go ahead to ask them the PQRST2 questions, and you refer them to the pain management team, and also you come back to do regular reassessment. You offer non-medical intervention like repositioning, deep breathing exercise to the patient, and the next thing you are going to do is to also offer the change of analgesic or arrange for the change of analgesic, and you are also going to tell them you are escalating everything to the medical team. This is the overview of pain assessment during your OSCE. Now we are going to go on to perform this station. You begin by saying, I can confirm the scene is safe. I'll provide privacy and dignity. I'll perform my hand hygiene following 7 steps of WHO guidelines. Hello, good morning. My name is Obaapre. I'm your attending nurse for today. Can you please confirm your name, date of birth, whilst I cross-check with my documents and your wristband? My name is Araba Lawson. Date of birth is 10th March 1945. I can confirm I'm with the right patient. Araba, I'm here to conduct a pain assessment on you as per your concerns of having pain. Is it the right time and are you happy I proceed? All right, thank you very much. Do you have any allergies, and if yes, what are your reactions? Okay, you don't have any allergies. Okay, I will note that. How would you like me to call you? Araba. All right, Araba. Before that, are you comfortable? No, I'm not really. I'm in pain. Now, I'm going to ask you a series of questions for us to plan a better care or a better pain management for you. Is it the right time and are you happy I proceed? Okay, thank you very much. I will begin with P. So I'm going to go through a questionnaire with you, which is the PQRST2. Is that all right? Thank you very much. So to begin with, where is the pain and what causes the pain? My pain is at my back, and I think when I stand for too long, it is really intense. What makes it worse or better? I think too much standing makes it worse, and then when I sit or when I lie down, it really helps the pain. How does your pain feel like? Is it dull, sharp, intense, or burning? Or the pain is quite intense, but it's sometimes dull, it's sometimes crashing occasionally. All right, so moving on to radiating, is the pain at one place, does it move around, or did it start from somewhere? Literally, I think the pain started from my waist, but it moves around through to my back. I'm going to note this. On a scale of 0 to 10, with 0 being no pain and 10 being the worst, can you please rate your pain? 8? Okay, that is a severe pain. Have you had any analgesic? Yes, I had analgesic 2 hours ago. Oh, okay. I'm going to monitor you further for effectiveness of the medication, but if it's still severe like this, I'm going to possibly escalate it to the medical team so that they can arrange an appropriate analgesic for you. When did the pain start, or how long does it last when it comes? The pain started about 2 days ago, and when it comes, it lasts for like 2 hours and comes and go like that. Okay. And does it start sudden or gradual? It starts suddenly. Oh, okay. All right. I will note that. Are you happy I refer you to the pain management team for a better plan of care? Okay, absolutely. I'm going to do that for you. All right. I'll also encourage you to be doing deep breathing exercise occasionally, and also make sure to assume a most comfortable position to help you. Please try and also hydrate as much as you can. If you need any support, let us know, and I will get you any support that you need. As I said, I'm going to escalate everything to the medical team so that we can plan a better care for you moving forward. I will be coming back to do a regular reassessment of your pain so that it will help us know how best our treatment is going. Is that all right with you? All right, thank you very much. Do you have any question or any concerns for me? Thank you very much. Use this call bell if you need me. me, and then I'll come back and help you. Is that okay? I will perform a quick hand hygiene and then I will leave the scene. This is how you are going to talk to the patient during your OSCE about the pain management. Mind you, the questions are not going to be given to you. The PQRST questions are not going to be given to you. You either memorize it or you study how the pain assessment question flows so that you'll be able to appropriately ask the patient these questions and flow specifically to suit to get a pass for this station. That is how the pain assessment is. We have acted professionally throughout the procedure. You are going to talk and ask the patient all the questions, and everything will be escalated appropriately. And also you verbalize that if there is any concerns, they should let you know as soon as possible. You are going to come back to do regular reassessment and all of that. This is how the pain assessment station looks like. If at any point I was presenting and then as I was presenting I forgot that I needed to ask a question about radiating, does it start from somewhere, but I forgot to ask and I went on to severity and time, I can still come back and ask that question. Mind you, you are not obliged to stay sequentially with the questions you are asking. You can ask the questions anyhow possible, but make sure to ask every question in this station. This is the end of the pain assessment in your OSCE. As a nurse and a nurse associate, this is what you are going to expect or what you are going to be doing during your pain assessment station. Make sure to subscribe to this channel for subsequent OSCE video to enable you to pass your OSCE once and for all. And also make sure that you share this video to your OSCE buddies so that they will be able to learn this station and pass. The goal is for us to pass together. Thank you very much for watching, and we shall meet in the next video.